My name is Robert Hasty. I'm the mayor of the city of Ottawa, and I, like the rest of City Council, were excited to learn initially of the plans that OSF had for a new hospital here in Ottawa. A $120 million investment into our community is something that everyone would agree would be beneficial. A new hospital is needed, and we are very much looking forward to that. However, the details of what this new hospital was going to consist of, we found it very alarming.
I was shocked recently to learn that OSF plans to drastically reduce services at the Ottawa Hospital. To refresh my memory, I went back to the application that OSF filed to obtain ownership of the Ottawa facility. The application specifically indicated that the Ottawa community, and I'm going to quote, would benefit from the proposed facility as there will be no decrease in service, scope, or level of care currently provided. The community will also benefit and experience cost savings through access to more clinical specialists, allowing patients to receive office visits and care locally rather than having to travel. So you can see that community was very important to the Ottawa Hospital at the time, and it appeared to be important to OSF too.
They were wanting to move us from approximately 50 med-surg beds down to 12. Currently, on an average day, the Ottawa Hospital has roughly around 30 people that are there for inpatient care. If you look at that number, look at the low end of that, you're looking at 15 people. So on day one of this new facility, already having to transport 3 people at a minimum over to Peru.
What's really upsetting is finding out now that OSF is not doing everything in the greatest care and love and patient experience. It's all about billable units, getting the bodies in and out, one question, 15 minutes.
The severe reduction in hospital beds planned for Ottawa still leaves our planning region extremely underbedded. We will be short 24 medical surgical beds as determined by the state for our need in our area. It's going to lead to out-migration where patients are going to have to travel farther outside of our planning region or outside of our local area to receive that care.
So we're looking back at the numbers in 2023. Of those 2,344 transports, 572 of those need to be transferred out to either OSF St. Francis in Peoria or OSF St. Anthony's in Rockford. Another 1,388 of those had to be admitted to the hospital here in Ottawa. If we're looking at 50% reduction of the med-surg beds, possibly 700 of those might have to be transferred over to OSF St. Elizabeth's in Peru, which will cause strain on the EMS system, not only for us, for the city of Ottawa, but also local departments around us as well.
I am not opposed to Ottawa getting a new hospital. I am opposed to the size recommendations they're making for our hospital. There is enough need in LaSalle County to sustain 2 acute care facilities.
Oftentimes our officers are out there and the emergency room is stacked with patients and the waiting room is full of patients waiting to be seen. The plan that they've presented is one that will create a greater concern since these issues have not been addressed in the last 12 years. Do they have the greatest care and love in the service that they're going to provide to our community? And I would say no.
OSF themselves have said that they are not fully utilizing the hospital beds in Mendota, Princeton, or Kewanee, and now they're adding more beds west of 39. Meanwhile, they are cutting Ottawa's campus by 2/3 when there are no supporting services in Marseilles, in Streeter, or in Sheridan, or any of those communities. They are essentially making a desert of healthcare east of I-39, and that is not a well-balanced wheel, in my opinion. So this is not just an argument for Ottawa, it's an argument for all of eastern LaSalle County.
I believe it's time for OSF to withdraw its application and go back to the drawing board and hopefully involve the community it purported to care so much about back in 2012.
I would like them to sit back down at the table, discuss a better plan and a better avenue, and bring all the stakeholders in that have an actual stake in the game to better serve our people.
So please, reconsider, rethink this.